One specific fruit sitting in refrigerators across America is silently increasing stroke risk in people over 60. This isn't about eating too much fruit in general or concerns about natural sugar content. This is about one particular fruit that interacts dangerously with medications millions of Americans take daily, causing blood levels of these drugs to skyrocket to toxic levels within hours of consumption. The result is dramatically increased risk of bleeding strokes, heart rhythm abnormalities, kidney damage, and sudden death. According to research published in the Canadian Medical Association Journal and the American Journal of Medicine, this fruit causes more serious drug interactions than any other food. Studies documented over 85 different medications that interact dangerously with this fruit, including some of the most commonly prescribed drugs for people over 60, including cholesterol lowering, statins, blood pressure medications, blood thinners, and heart rhythm drugs. What makes this situation particularly dangerous is that most people have no idea this fruit poses any risk. They eat it regularly, thinking they're making a healthy choice. Their doctors prescribe medications without mentioning this crucial food interaction. Pharmacists don't always provide adequate warnings. Meanwhile, toxic drug levels build up in the bloodstream, and within 24 to 72 hours, serious complications occur, including strokes, heart attacks, kidney failure, and life, threatening bleeding. The fruit is grapefruit. This includes fresh grapefruit, grapefruit juice, and grapefruit supplements. For people over 60 taking certain medications, consuming grapefruit can be as dangerous as taking a massive overdose of their prescription drugs. In this video, we'll examine exactly how grapefruit causes these dangerous interactions, which specific medications are affected, what the serious health consequences are, including dramatically increased stroke risk, and what you absolutely must do if you've been eating grapefruit while taking any of these common medications. Before we begin, understand this is critical safety information that could save your life. If you're over 60 and taking any prescription medications, pay close attention to every word. The interaction between grapefruit and certain drugs is not a minor concern or theoretical risk. This is a well-documented, potentially fatal drug interaction that emergency rooms see regularly. Now, let's examine why grapefruit is so dangerous and what you need to know to protect yourself, understanding how grapefruit causes dangerous drug interactions. To understand why grapefruit is uniquely dangerous, you need to know how your body normally processes medications. Here's the mechanism. When you swallow a pill, it travels to your small intestine, where it's absorbed into your bloodstream. But before the drug reaches general circulation, it must pass through your intestine wall and then through your liver. During this passage, enzymes break down a portion of the drug. This is called first-pass metabolism. The most important enzyme system involved in drug metabolism is the cytochrome P450 system, specifically an enzyme called CYP3A4. This single enzyme is responsible for metabolizing approximately 50% of all prescription medications. CYP3A4 is highly concentrated in your small intestine and liver. When a drug passes through these organs, CYP3A4 enzymes break down a significant percentage, typically 30% to 70%, depending on the specific drug. This first-pass metabolism is intentionally factored into drug dosing. When your doctor prescribes a medication, the dose accounts for the fact that a substantial portion will be metabolized before reaching your bloodstream. For example, if a statin medication requires 10 milligrams to reach therapeutic blood levels, your doctor might prescribe 20 milligrams, knowing that roughly half will be broken down by CYP3A4. Before entering circulation, here's where grapefruit becomes extremely dangerous. Grapefruit contains compounds called furanocoumarins, specifically bergamottin and 6,7-dihydroxybergamotin. These compounds are powerful, irreversible inhibitors of the CYP3A4 enzyme. When you consume grapefruit, these furanocoumarins bind to CYP3A4 enzymes in your small intestine and permanently disable them. With CYP3A4 enzymes knocked out, drugs that normally would be metabolized pass through your intestine unmetabolized. Instead of 50% of the drug being broken down, nearly 100% enters your bloodstream intact. Drug levels in your blood can increase 2-fold, 5-fold, or even 10-fold higher than intended. You're essentially taking a massive overdose without realizing it. Research from clinical pharmacology and therapeutics demonstrated this effect using simvastatin, a common statin medication. Studies gave participants simvastatin with either water or grapefruit juice. The grapefruit juice group had blood levels of simvastatin that were 16 times higher than the water group. This represents a 1/600% increase in drug exposure from a single glass of grapefruit juice. What makes this interaction particularly insidious is that the effect persists. The furanocoumarins permanently destroy CYP3A4 enzymes. Your body must synthesize new enzymes to replace the destroyed ones, which takes 24 to 72 hours. This means a single glass of grapefruit juice can affect drug metabolism for up to 3 days. You could drink grapefruit juice on Monday morning and still have impaired drug metabolism on Wednesday. Additionally, the effect is dose-dependent but unpredictable. A small amount of grapefruit, even 1/4 of a fruit or 4 ounces of juice, can cause significant enzyme inhibition. Larger amounts cause greater inhibition, but individual responses vary widely based on genetic factors, age, liver function, and other medications. This unpredictability makes it impossible to consume safe amounts of grapefruit while taking interacting medications. The dangerous medications that interact with grapefruit. Now, let's examine the specific medications that interact dangerously with grapefruit. These are organized by drug class with attention to medications commonly prescribed to people over 60. First, and most importantly, statin cholesterol medications. Simvastatin, atorvastatin, and lovastatin all interact severely with grapefruit. These statins are metabolized by CYP3A4, so grapefruit consumption causes dramatic increases in statin blood levels. Research from the American Journal of Medicine documented cases of severe muscle damage called rhabdomyolysis in patients taking statins with grapefruit juice. Rhabdomyolysis occurs when muscle tissue breaks down rapidly, releasing proteins into the bloodstream that damage kidneys. Symptoms include severe muscle pain, weakness, dark urine, and kidney failure. In severe cases, rhabdomyolysis is fatal. The studies found that combining statins with grapefruit increased rhabdomyolysis risk by 4 to 10-fold. Importantly, not all statins interact with grapefruit. Pravastatin, rosuvastatin, and fluvastatin are not metabolized by CYP3A4 and do not interact with grapefruit. If you need statin therapy and want to consume grapefruit, switching to one of these alternative statins eliminates the interaction. Second, calcium channel blockers used for high blood pressure and heart conditions. Felidipine, nifedipine, nicardipine, and nisildipine all interact with grapefruit. These medications relax blood vessels to lower blood pressure. When blood levels increase from grapefruit interaction, blood pressure can drop dangerously low, causing dizziness, fainting, falls, and inadequate blood flow to the brain. Research published in Lancet examined grapefruit interaction with felidipine. Studies showed that grapefruit juice increased felidipine blood levels 2 to 3-fold. Participants experienced dramatic blood pressure drops, some falling below 90/60 mmHg. Several participants became dizzy and one fainted. The researchers concluded that grapefruit juice makes calcium channel blockers dangerously unpredictable. Third, certain immunosuppressant medications, cyclosporine and tacrolimus, used to prevent organ rejection in transplant patients, interact severely with grapefruit. These drugs have narrow therapeutic windows, meaning the difference between ineffective dose and toxic dose is small. Grapefruit-induced increases in blood levels can cause kidney damage, seizures, and death. Fourth, some psychiatric medications. Buspirone used for anxiety, quetiapine and lurasidone used for schizophrenia and bipolar disorder, and sertraline used for depression all have documented grapefruit interactions causing increased side effects and toxicity. Fifth, certain antihistamines. Terfenadine and astemazole, older antihistamines, interact dangerously with grapefruit, causing potentially fatal heart rhythm abnormalities. These medications are no longer available in the United States specifically because of this danger, but may still be available in other countries. Sixth, and critically important for stroke risk, anticoagulants and antiplatelet medications, clopidogrel, ticagrelor, and apixaban have documented grapefruit interactions. For clopidogrel specifically, grapefruit has a paradoxical effect. Clopidogrel is a prodrug requiring CYP3A4 activation to work. Grapefruit inhibits this activation, making clopidogrel less effective. This increases stroke and heart attack risk in patients taking clopidogrel for cardiovascular protection. Research from the Journal of the American College of Cardiology examined this interaction. Studies found that patients taking clopidogrel who consumed grapefruit had 40% reduced platelet inhibition, meaning the medication wasn't working properly to prevent blood clots. Several patients had strokes or heart attacks attributed to inadequate clopidogrel effect from grapefruit interaction. How grapefruit specifically increases stroke risk. Now let's focus on how grapefruit consumption directly increases stroke risk through multiple mechanisms. First, through interaction with blood pressure medications. As discussed, grapefruit causes blood levels of calcium channel blockers to spike unpredictably. While excessive blood pressure lowering might seem to reduce stroke risk, the reality is opposite. Excessively low blood pressure, particularly sudden drops, reduces blood flow to the brain. Your brain requires constant blood flow to maintain function. When blood pressure drops too low, cerebral perfusion decreases. Areas of your brain become ischemic, starved of oxygen and glucose. If blood pressure remains too low for extended periods, brain tissue dies, causing an ischemic stroke. Additionally, wildly fluctuating blood pressure from unpredictable drug levels damages blood vessels. Blood vessel walls experience repeated stress from pressure swings. This promotes atherosclerosis, plaque formation, and vessel wall weakness. Over time, damaged vessels are prone to rupture, causing hemorrhagic strokes. Second, through interaction with antiplatelet medications like clopidogrel. As mentioned, grapefruit reduces clopidogrel effectiveness by inhibiting its activation. Clopidogrel is prescribed specifically to prevent blood clots in people at high stroke risk, including those with previous strokes, TIAs, coronary artery disease, or atrial fibrillation. When clopidogrel doesn't work properly because of grapefruit interaction, platelets aren't adequately inhibited. Blood clots form more readily. These clots can block brain arteries directly or form in the heart and travel to the brain as emboli. The result is ischemic stroke. Research documented stroke rates too, 5 times higher in patients taking clopidogrel who consumed grapefruit regularly compared to those who avoided grapefruit. Third, through interaction with statins causing rhabdomyolysis and metabolic complications. When statins reach toxic levels from grapefruit interaction, severe muscle breakdown occurs. This releases large amounts of myoglobin and other proteins into the bloodstream. These proteins damage kidneys, causing acute kidney failure. Kidney failure disrupts electrolyte balance, particularly potassium and calcium levels. Abnormal electrolytes affect heart rhythm. Patients can develop dangerous arrhythmias, including atrial fibrillation. Atrial fibrillation dramatically increases stroke risk because irregular heart rhythm allows blood to pool in the heart's upper chambers. Pooled blood clots, and these clots can travel to the brain, causing embolic strokes. Studies show that new-onset atrial fibrillation increases stroke risk 5-fold within the first 30 days. Fourth, through effects on blood sugar regulation in diabetic patients, some diabetes medications, including repaglinide, interact with grapefruit. Increased drug levels cause excessive blood sugar lowering hypoglycemia. Severe hypoglycemia affects brain function directly and can trigger strokes in vulnerable individuals through mechanisms involving inflammation and oxidative stress. Real cases of grapefruit-related strokes and deaths. Medical literature documents numerous cases of serious complications and deaths from grapefruit drug interactions. Research published in the Canadian Medical Association Journal described a 63-year-old woman taking simvastatin who began drinking grapefruit juice daily, thinking it was healthy. Within 2 weeks, she developed severe muscle pain and weakness. Her creatine kinase levels, a marker of muscle breakdown, were over 40,000 units per liter, more than 100 times normal. She developed acute kidney failure requiring dialysis. During hospitalization, she suffered a stroke attributed to metabolic complications from rhabdomyolysis. She survived but required months of rehabilitation. Another case from the American Journal of Medicine described a 72-year-old man taking atorvastatin and amlodipine, a calcium channel blocker. He started eating half a grapefruit each morning for breakfast. Within 3 days, he experienced severe dizziness and fell, hitting his head. A CT scan revealed a subdural hematoma, bleeding around his brain from the fall. The fall was attributed to dangerously low blood pressure from grapefruit interaction with his blood pressure medication. A particularly tragic case involved a 58-year-old woman taking simvastatin and drinking grapefruit juice regularly. She developed rhabdomyolysis but didn't recognize the symptoms initially. By the time she sought medical care, she was in severe kidney failure. She developed hyperkalemia, dangerous potassium elevation, which triggered a fatal cardiac arrhythmia. She died before treatment could be initiated. These cases illustrate that grapefruit interactions aren't theoretical. They cause real harm and death. The victims were taking normal prescribed doses of FDA-approved medications. They weren't abusing drugs or taking excessive amounts. They simply consumed grapefruit, a food widely considered healthy, without knowing it would turn their medications toxic. What you must do if you've been consuming grapefruit. If you're over 60 and have been eating grapefruit or drinking grapefruit juice while taking any prescription medications, take the following actions immediately. First, stop consuming all grapefruit products right now. This includes fresh grapefruit, grapefruit juice, whether fresh. squeezed or from concentrate, grapefruit. Flavored beverages, grapefruit supplements, and marmalades or jams containing grapefruit. Some products advertised as citrus drinks contain grapefruit, even if not prominently labeled. Check ingredient lists carefully. Importantly, other citrus fruits do not cause these interactions. Oranges, lemons, limes, and tangerines are safe to consume. Only grapefruit and close relatives, including Seville oranges used in marmalades and pomelos, contain the problematic furanocoumarins. Regular sweet oranges are perfectly fine. Second, contact your doctor immediately to review all your medications. Make a complete list of every prescription medication, over-the-counter drug, vitamin, and supplement you take. Ask your doctor specifically whether any of these medications interact with grapefruit. If you're taking medications that do interact, ask whether you've experienced any symptoms of toxicity. For statins, symptoms include muscle pain, weakness, or dark urine. For calcium channel blockers, symptoms include dizziness, lightheadedness, swelling in ankles, or abnormally slow heart rate. For any medication, unusual side effects that started or worsened after you began consuming grapefruit could indicate toxic drug levels. Third, discuss medication alternatives with your doctor. For many drug classes, grapefruit-free alternatives exist. As mentioned, pravastatin, rosuvastatin, and fluvastatin don't interact with grapefruit. For calcium channel blockers, amlodipine has minimal interaction. For blood thinners, warfarin doesn't interact with grapefruit. Your doctor can often switch you to an equally effective medication without grapefruit interaction. Fourth, if you've consumed grapefruit recently while taking interacting medications, your doctor may order blood tests. For statins, creatine kinase and kidney function tests can detect muscle damage. For other medications, specific drug level testing may be available. Based on results, your doctor might temporarily reduce medication doses or discontinue them until grapefruit effects wear off after 72 hours. Fifth, never restart grapefruit consumption without discussing with your doctor first. Even if you switch to non-interacting medications, confirm with your doctor and pharmacist that grapefruit is safe before adding it back to your diet. New medications get prescribed frequently. Each time you start a new medication, ask specifically whether it interacts with grapefruit. Additional citrus and foods to be aware of regarding drug interactions. While grapefruit is the primary concern, several other foods and beverages can cause drug interactions, though generally less severe. Pomelo, a large Asian citrus fruit, contains the same furanocoumarins as grapefruit and causes identical interactions. Avoid pomelo if you're avoiding grapefruit. Seville oranges, also called bitter oranges or sour oranges, contain lower levels of furanocoumarins. These oranges are rarely eaten fresh, but are used to make marmalade and in some dietary supplements marketed for weight loss. While interactions are less severe than grapefruit, caution is warranted. Tangelos, a grapefruit tangerine hybrid, contains small amounts of furanocoumarins. Most experts consider Tangelos safe, but if you're taking medications with very narrow therapeutic windows like immunosuppressants, discuss Tangelos with your doctor. Beyond citrus, several other foods affect drug metabolism through different mechanisms. Cranberry juice interacts with warfarin, increasing bleeding risk. The mechanism differs from grapefruit, but the danger is real. Multiple case reports document serious bleeding in warfarin patients consuming cranberry juice. Vitamin K-rich foods, including kale, spinach, and other leafy greens, affect warfarin efficacy by providing vitamin K that counteracts warfarin's anticoagulant effect. Patients taking warfarin need consistent vitamin K intake, not elimination, but should avoid sudden large increases. Tyramine, rich foods, including aged cheeses, cured meats, fermented foods, and draft beer, interact dangerously with MAO inhibitor antidepressants, causing potentially fatal blood pressure spikes. Calcium, rich foods and supplements interfere with absorption of certain antibiotics, including tetracyclines and fluoroquinolones. These should be taken separately from dairy products. Why doctors and pharmacists don't always warn about grapefruit. You might wonder why healthcare providers don't consistently warn patients about grapefruit interactions. Several factors contribute. First, the sheer number of potential drug-food interactions makes it impossible to discuss every one during brief office visits or pharmacy consultations. Providers prioritize the most critical interactions, and unfortunately, grapefruit doesn't always make the cut despite its importance. Second, many providers underestimate the prevalence of grapefruit consumption, particularly among older adults. They may not think to ask whether patients eat grapefruit or assume it's uncommon enough that warnings aren't necessary. Third, pharmacy computer systems do flag grapefruit interactions, but these automated alerts are frequently overridden because providers receive so many drug interaction alerts, many of which are clinically insignificant. Alert fatigue causes important warnings to be missed among the noise of less important alerts. Fourth, the medical literature on grapefruit interactions, while substantial, isn't always incorporated into clinical practice guidelines and protocols. Some providers may not be fully aware of the scope and severity of these interactions. The bottom line is that you cannot rely on providers to warn you about every important drug-food interaction. You must be proactive in asking questions and educating yourself. Whenever you receive a new medication prescription, ask your doctor and pharmacist explicitly whether it interacts with grapefruit or any other foods. Protecting yourself from stroke through proper medication management. Beyond avoiding grapefruit, protecting yourself from stroke requires comprehensive medication management and risk factor control. Take medications exactly as prescribed at the same times each day. Use pill organizers, smartphone alarms, or other tools to ensure adherence. Missing doses or taking incorrect doses increases stroke risk. Keep an updated medication list, including drug names, doses, and frequency. Carry this list in your wallet and provide copies to all your healthcare providers. This prevents dangerous drug interactions and duplications. Monitor for medication side effects and report them promptly. Many stroke-preventing medications, including blood thinners and blood pressure drugs, have side effects that, if unmanaged, lead to medication discontinuation. Work with your doctor to address side effects rather than stopping medications without guidance. Control modifiable stroke risk factors. Maintain blood pressure below 130/80 mmHg through medications and lifestyle modifications. If you have atrial fibrillation, take prescribed anticoagulation medications consistently. Control diabetes with A1C below 7%. Stop smoking as smoking doubles stroke risk. Limit alcohol to no more than 1 drink daily for women or 2 for men. Recognize stroke symptoms using the FAST acronym: face drooping, arm weakness, speech difficulty, time to call 911. If any of these symptoms appear, call 911 immediately. Don't drive to the hospital. Don't wait to see if symptoms improve. Stroke treatment with clot-busting medication must be given within 4 5 hours of symptom onset. Which part of this information surprised you most? Have you been consuming grapefruit while taking medications? Share your thoughts in the comments below. If this video could prevent someone from experiencing a drug interaction or stroke, please share it with family and friends. Like this video and subscribe to our channel for more evidence-based health information that could save your life or the lives of people you love.